see. Okay. So we're going to be talking about another novel agent that's being developed in bladder cancer that's in early phase clinical trials. So this is a drug IDE397, which is a novel MAT2A inhibitor. And so this was just presented last month at the Triple meeting as a late-breaking abstract. Okay, so bear with me while we talk about some metabolic pathways. So let's see if we can... Okay, so when a patient has a homozygous MTAP loss, that leads to accumulation of MTA. And so as MTA builds up, you get inhibition of PRMT5, and that's responsible for methylating SAM and leads to RNA splicing and gene expression and genome integrity. And so we can take advantage of this the defect in this pathway by also blocking MAT2A. So MAT2A is responsible for producing SAM in cells. And so this drug, IDE397, blocks MAT2A. And so in combination with MTAP loss, leads to synthetic lethality and cell death. And so this is a great option for patients who have homozygous MTAP loss. That's seen in about 15% of solid tumors and about 25% of bladder cancer. So you can see that the IDE397 is very specific for MTAP loss cells. It doesn't affect wild type cells. And then you can see in the bottom right corner in a bladder PDX model, good tumor volume inhibition. So this is a phase 1 study, so a first-in-human monotherapy and combination trial. So this was first open in all solid tumors and monotherapy, and now is open in expansion in non-small cell lung cancer and urothelial carcinoma. So there's arms that are monotherapy, and then also now IDE397 plus sacituzumab govitecan in urothelial carcinoma. So any patients who have MTAP homozygous deletion by NGS or by IHC are eligible. And so looking at the third column there, which is urothelial carcinoma, these are the patients that were dosed at 30 milligrams daily. This was chosen as the recommended phase 2 dose. And so we're just going to focus on just this cohort. More data on other cohorts is to come in the future. But so far, we're looking at the cohort of patients that were dosed at 30 milligrams. And so that included 10 urothelial carcinoma patients. These were very representative, about median age of 69, mostly male, and then about 40% had 3 or more prior treatments, so pretty heavily pretreated. This drug so far is actually really well tolerated, especially at the 30 milligram daily dose. So at this dose, there were no treatment-related discontinuations, there were no serious adverse events, and lots of patients that were on and tolerated for long periods of time, more than 6 months. And so this is looking at 28 patients, so a mix of non-small cell lung cancer and urothelial. And you can see mostly low grade, grade 1, grade 2 adverse events, fatigue, decreased appetite, some bumps in creatinine, some nausea, very, very manageable. The one thing is there is a little bit of peripheral neuropathy. So about 25% of patients did have low grade, grade 1, grade 2 peripheral neuropathy. Now, all of these patients had cisplatin-based chemotherapy. Some of them went into this with neuropathy. We have found that this neuropathy is a little bit different in that it resolved quickly upon stopping the drug. And so that was encouraging. So this is looking at response rate for all of those 27 patients, urothelial and non-small cell lung cancer, dosed at the 30 milligram dose. And so you can see there was an overall response rate of 33%. When we look at just the UC patients, those were 10 patients, 4 patients had a partial response, and another 4 patients had stable disease. So really only 2 out of the 10 progressed through treatment. So very encouraging data for heavily pretreated bladder cancer patients. This is looking at ctDNA analysis, so looking at molecular responses. So this is of the 21 patients who had ctDNA data available. All of them had a molecular response, and you can see some pretty deep molecular responses there. Looking at our swimmer's lanes, there's patients who have been on drug for almost a year. So some patients who have had really good responses. 15 of the 27 patients are still remaining on treatment. 7 of the 9 patients with a partial response or complete response are still on treatment. The median duration of treatment is over 6 months, and we still don't have data yet on median duration of response, or PFS. So just looking at some patient studies. So this is a 60-year-old male who had had neoadjuvant chemo, had a nephroureterectomy for upper tract urothelial, adjuvant nivolumab, and then progressed and went on study and had a complete response in his lymph nodes. This is another looking at a primary bladder tumor. So again, a patient who had neoadjuvant chemo ended up getting chemo RT and then went on study for disease progression and had a good response in the primary tumor. Okay, so this trial is now open in combination with sacituzumab govitecan. So the rationale here is that, with the MTAP loss, we're not making as many purines and nucleotides, and so we're developing issues with DNA repair. And so can we take advantage of that by using a topoisomerase inhibitor? So you can see in the top right, this is a bladder cancer model using IDE397 plus irinotecan, and you can see some good tumor growth inhibition there. So this is, there's been a few patients treated in the combo arm. This is one of them. So a 60-year-old male who has an MTAP homozygous loss and an FGFR fusion, who progressed through enfortumab vedotin plus pembrolizumab, progressed through erdafitinib, and so went on study and has had a really great response, actually now 38% reduction in his tumor volume. And there's been 2 patients so far treated on the combo arm, and both of them have had a really impressive molecular response with nearly 100% of the ctDNA. So in summary, IDE397 is the first MAT2A inhibitor to demonstrate clinical efficacy in MTAP-deleted tumors. There's promising anti-tumor activity, about 40% response rate in urothelial, good disease control rates. Monotherapy expansion is ongoing in urothelial and a combination with sacituzumab govitecan. So a great trial to think about for your MTAP-deleted patients. So thanks to IDEA Biosciences who's sponsoring the trial and everyone participating.